I'm joined now by Shirley Cramer, RSPH CEO. Shirley, lovely to see you again. Thanks for coming in. Another busy year for public health. What would you say have been the key challenges?
I think the key challenges this year have been around mental health and also the issue of childhood obesity. This is not going away anytime soon. It's very complex, it's very multi-sectorial. There's lots of different angles we need to tackle it, and we need to do more quite urgently in that area. So we've been looking at a lot of things like how do you make a healthy supermarket, how do you make a healthier environment. Our Health on the High Street looked at healthier environments and what we can expect and what we should be having. Lots of green space, lots better shops, and lots of things, not having takeaways near schools, for example. So we need to change things around planning as well. So obesity and mental health. We've got lots of issues and social media and young people's mental health, and we've talked about that before, but this year we went a little bit farther and launched an all-party parliamentary group on social media and young people's mental health. We had an inquiry. The inquiry came up with a series of recommendations which are now being looked at by government, and the Online Harms White Paper will pick up some of those recommendations. So we feel that actually we've made some headway with this, even though there's a long way to go.
We've talked in the past, haven't we, Shirley, about social prescribing. Do you feel like you're having any cut through with that? Are you making headway?
So something interesting happened this year in public policy, and that is that the NHS, for the first time in its long-term plan, highlighted the need for social prescribing in every GP area. And that has meant, in a way, that this burgeoning and useful link workers, social prescribers, helping people to get the right kind of services, will actually be strengthened. So a normal social prescribing would be somebody who would, instead of having medication for depression, you might actually go to art courses. If you need support with employability, job readiness, then you can go and get support from a voluntary sector organisation that would help you with that. So really looking at people's lives and saying, what is it that's going to improve your life? And actually social prescribing can really pinpoint the areas, whether you're young, adult worker or older, where those services, those connections you might want to make can be made in your community.
It can be so effective, can't it? If you look at the government's take on things, they seem to be very focused on prevention, certainly if you reference their green paper. Where are you on prevention? Do you feel that's the right strategy?
Well, for the first time, the Secretary of State for Health and Social Care has shown a real interest in prevention by having this green paper on prevention. And of course, we submitted our views, and I think our views were very comprehensive in that the usual things you might expect. We'd like to see minimum unit pricing on alcohol, we'd like to see better labelling, we'd like to see more on the sugar levy, more on reformulation, particularly for children's food that's high in fat, sugar and salt. But actually what we really need to see is focus and investment in communities. So for example, we know from our work last year that the geographic areas in England which are the poorest map closely to what we call the indices of multiple deprivation. And then we know in all of those areas we will see higher levels of obesity, higher levels of poor mental health, less jobs. So all the things that make us healthy and happy, in those areas it's harder. So investment in those areas in all sorts of services, particularly early years. So we've really focused on those social determinants of health in saying to the department what we think should happen.
Let's talk about vaccinations now. Some of what you've just talked about is relevant with vaccinations as well, isn't it, in terms of pricing and all the rest of it. It's often on the news, isn't it, vaccinations? A lot of controversy and huge headway. Where do you feel we're going with vaccinations?
So I think we've made quite a big contribution in that conversation this year. We produced a report called Moving the Needle, which looked at the uptake and public attitudes to vaccination across the life course. And what was really interesting is in this paper, we look at the trends we're seeing. And one of the worrying trends is the fact that young parents, so parents of under 5-year-olds, are seeing a lot of negative activity, a lot of negative messaging on the social media platforms. So we are talking to government with other organisations about the kind of messages that need to be on those platforms. We've talked to Facebook and Instagram and Twitter about having much more positive messaging around vaccination, and also looking at delivery systems. So sometimes we need to be where people are. We need to make it very easy for people to get vaccinated, and we need to answer parents' questions. So one thing we do know from the surveys around vaccine confidence is that often young parents want their questions answered. Is this vaccine effective? Will it make my baby not feel very well for a week? And because we've had a shortage of health visitors, because of austerity, shortage of time spent with a GP or with the practice nurse, lots of people aren't getting those questions answered. So I think there's a mixture of things that we can really get right with vaccinations to get us up to the best, to be the best in the world.
There's always so much to talk to you about, but let's look ahead now and what's going to be on the agenda in the year ahead. So some very interesting things happening in the years ahead. We've just launched the first ever infection control qualification, and in Wales from next year, all tattooists and body piercers are going to have the infection control qualification to get a license. I mean, you probably thought they had that already, but actually they don't. And so one of the things that we're going to be talking about the Chief Medical Officers of Health for the UK is about a licensing scheme for this across the UK, so that wherever you go, it's going to be much safer to have a tattoo or body piercing. The other area we're spending a bit of time looking at is gambling, the issues of debt and mental health and family resilience. But gambling particularly, you'll know it's been in the news quite a lot. There's really progression routes from gaming to gambling for many children, and the evidence is going in the wrong direction. So we want to look at that and say, what is it we need to put in place to make children safe, and also to make it less easy for people to get addicted and to be they're very vulnerable. And what happens is that organisations, the betting companies, prey on them via social media and other ways. So that's a big focus for public health in the future. Well, we look forward to following that progress with you along the way. Shirley Cramer, thank you. Thank you.